Thank you, Council President. I want to thank Majority Leader Councilmember Parker for her resolution in honor of Dr. Emma Chappelle. I reflected my comments last week, but I thank her and all the people that spoke on her behalf for the phenomenal spirit that she is in the city of Philadelphia. Also reflecting on the minister that Councilmember Heenan brought to council today, and one of the statements she said kind of struck me. It says, "Speak up for those who cannot be spoken up for." I think that echoes the work that our colleague Councilmember Brooks has taken on in reference to her legislation was introduced today. I want to thank her for sharing that very personal story and her speaking up for her loved one who's no longer with us, but allowing us to speak up for those who can't speak up for themselves. This also brings me to the point that I want to raise this morning in council. Some of us in this body have gotten to know Cecilia Thompson. She is a new member of our school board. Many of us have known her for some time for her advocacy, not only in reference to special education in the school district, but also in the autism community in reference to the work she's done with her son. There was an article in this week's Inquirer about her challenges in getting vaccinated as a caregiver for her son. And what troubles me is that this issue, I started hearing this concern back in December when the city was starting to first get vaccinations, and advocates like Anna Perng and others raised a concern about going to the convention center, which is a large space, and the challenges and concerns for those who are both caregivers as well as those on the autism spectrum or having other type of physical or non-physical differences, the ability to receive a vaccine. I'm not going to rehash all the challenges we had last year with the rollout of the vaccine at the convention center, but the concerns reference to caregivers, both those who are hired as direct service professionals as well as unpaid home caregivers for their children like Ms. Thompson, were raised by various emails and letters I received, in particular from Vision for Equality. And so we scheduled a meeting with the health department on January 22nd. And we raised the concern that if you are a personal caregiver for a loved one in your home or a direct service professional, are you in phase 1A? Because there was a discrepancy in that information. And based on the information we were given and provided, that if you were a person caring for your child at your home, you would be considered a caregiver under phase 1A. And at the state level, they are considered a phase 1A individual. And that's reflected based on the information that Ms. Thompson provided to the pharmacy. But in the city of Philadelphia, she was denied the ability to receive a vaccine under phase 1A based on being a caregiver, but she was able to get it based on other health concerns that she has. And this has been a consistent issue, not only for those who are personal caregivers, but also those that have a difference like autism or intellectual disabilities. Recently, Dr. Wendy Ross and Dr. Jonathan Gleason from Thomas Jefferson released a study based on the significant challenges that those with intellectual disabilities have and a higher propensity for them to unfortunately transition due to COVID-19. Based on, I believe, that study, the city decided to add those with intellectual disabilities into phase 1A. But if you live outside of the city of Philadelphia and you're a caregiver, you can get a vaccine as a caregiver on the phase 1A. But also, I've heard information about those who have neurological differences, which also can be connected with autism, have been able to get vaccinated in the city of Philadelphia as phase 1B. So there's a lot of discrepancy, a lot of information problems, a lot of gray areas. And if you look at the information that Dr. Farley provided in his press conference when this issue was raised, his statement was, it needs to be more clearly defined. Could everybody just say they're a caregiver of someone else? Now, we don't do checks for people that have diabetes. We don't do other checks for others. If you say you're an essential worker and you register, you're able to get a vaccine under phase 1A. But for some reason, if you're a caregiver for someone in your home that could be your child, we are putting you through a additional hurdle that if you lived in Bucks, Chester, Montgomery County, or one of the other 66 counties in the Commonwealth of Pennsylvania, you wouldn't have this challenge. And so this is an issue that I will continue to press on. It makes no sense that we're basically discriminating against those who are personal caregivers for their children who have a physical difference like autism, that they can't get vaccinated here in the city of Philadelphia. I'm glad that their children, if they have an intellectual disability, can now get vaccinated, but if they care for them in their home, can't. I'm also be pushing to make sure that those that have autism can get vaccinated in the city of Philadelphia. And it's a shame that at Lincoln Financial Field, and I won't say the date or time because they want to keep that just for the people they reach out to, but if you're a caregiver and you have a child that has an intellectual disability or autism, the Eagles Autism Initiative is vaccinating people with a provider from outside the city of Philadelphia, here in the city of Philadelphia. So it's a shame the fact that you can live in the city of Philadelphia, care for your child who has autism, but you can't get vaccinated by the city of Philadelphia, but you can be vaccinated by a provider from outside the city of Philadelphia, coming into our city and vaccinating those people who, based on research and information, have a higher propensity to perish due to COVID-19. This is an issue that doesn't make sense. I don't want to get too angry because I'm keeping myself calm this morning. But as the pastor said this morning, we need to speak up for those who can't speak for themselves. Thank you, Council President.